Hi, this video is to help you understand the relationship between um, the lower body and the pelvis. So when we walk, when we move, any sort of movement that involves the lower body and the movement of the lower legs and the femurs, it can oftentimes affect the pelvis. So just a quick refresher here, the femur is your upper leg bone. Your pelvis is comprised of two ilium, these kind of fan-like bones here, and then they articulate with this triangular shaped bone here at the back of your pelvis called the sacrum. So when you do any sort of movement that involves your lower body, such as walking, sitting even, the way that these bones articulate with one another, and then the way that the musculature, tension, tightness functions together can really have an impact on the movement that you feel throughout the lower back and throughout your pelvis in general. So it's mostly a self-assessment sort of exercise that we'll do today, so that you can start to really perceive the way that your lower body and the pelvis function together, and maybe even be able to articulate a difference between one side or the other, and the way that your body kind of works in conjunction as you move through some movements. So I'm going to bring our camera down here. We'll start in a bridge position. So as you come on down, you are going to start with your heels pretty close in towards your seat. Your hands can just rest wherever feels most comfortable for you. And then as you lie here, just start to let your body release down towards the ground. So take a moment just to get kind of settled in, to map the way that your body feels here as you lie on the ground. Noticing the way that your sacrum, your lower back feels. Notice the softness of your feet as they just land here, supporting your legs on the ground. And start to settle into your breath. See if you can just allow some heaviness through your torso, through your hips. Just a sense of softening in, softening down. Noticing what you notice there. Just gonna push this back a little bit. Okay. So here in our bridge position, all we're going to do to begin with is gently press into your feet so that you have a gentle rocking of the pelvis this way. So it's almost just like a flattening of the low back into the ground below you. So you're not lifting the hips like this. You're just gently pressing and noticing that your tailbone scoops up and that your lower back flattens onto the ground. So just doing that nice and slowly, getting that little pelvic rock. As you're doing this, noticing if the weight is shifting from one side more than the other, if it's easier for you to press into one foot or the other. Good, just going nice and slowly, just kind of assessing the ease of this for you, assessing how your lower back feels. Good, and then releasing that last press. We'll do the same thing, only we're gonna just do it 1 foot at a time. So we're gonna start with our right leg here. So the left foot is just gonna stay soft and supportive here on the ground. As you gently start to press into the right foot, your right hip is going to rock just a little bit. So you don't wanna press so much that your hips come up and off the ground, but rather just that same gentle press so that you flatten especially that right low back onto the ground. So just kind of pressing, assessing. You might notice that you're starting to engage a little bit through the back of the leg. To do that, totally fine. Keeping the upper body soft, stay connected in with your breath. And as you're doing this, notice which muscles are engaging for you. Notice the ease of that movement in your body. Notice how this feels for your low back. Notice if you feel like you have a lot of movement there, a little movement. Notice if there's anywhere that feels a little more stuck or that has good freedom of movement. Let's just do that side a couple more times. And then you can stop in the middle, allowing both feet to just be soft here on the ground. And take a moment here just to kind of assess how that feels now that we've done the right side and we haven't done the left side. Good. And then we'll do the same thing with the left side. So the right foot's just going to stay soft here on the ground. The left foot will press gently into the ground. And we'll notice all of those same things here. Firstly, you might notice if there's a difference from side to side. That might be very apparent to you. It might not be as apparent to you. So again, I'm just pressing gently into the bottom of that left foot and allowing my left ilium to rock, to scoop up just a little bit as I flatten the lumbar region onto the ground. Again, if you find that you're twisting, that whole pelvis is coming up and off the ground, that's too much. So it's just a gentle little press here. All the things to notice. So notice if it feels different from the right side. Notice if you have a little more movement here, less movement. Notice how it translates up into the sacroiliac joint, the lower back. Good, let's just do it a couple more times here on this left side. And then let any sort of pressure in that foot release and just notice side to side. See if you can map in your mind the major bones here of your pelvis, so the sacrum, the two ilium. Feel the bottoms of your feet on the ground. So the last thing we'll try here is, as if we're walking, we're gonna alternate feet, okay? So we're gonna start with the right foot pressing, little rock, release, left foot, press and rock. Good, so just back and forth, like this. Taking a moment to assess both sides. As you're walking back and forth, gentle pressing into the soles of your feet alternately. What do you notice? And I find the more that I do this, the longer that I do this, the more muscular engagement intrinsically I have in my deep gluteal muscles. And it's actually like pretty tiring the longer I do this. And I'm also noticing, just so you know what I'm feeling in my own body, just for some feedback that I'm getting, my right hip has much more movement than my left hip does. When I press into my right foot, it's a sense of ease here through the right side. My left one feels like the whole hip wants to lift up all together, and that it's all just like very much more tight through there and restricted through there. So as I'm thinking about this from like my massage point of view, that is very informative to me around like, my left side maybe has a lot more restrictions. My left side might also be easier to balance on because those restrictions are knitting together through the joint spaces and supporting me muscularly in a way that perhaps I don't have on my right side. So these constant questions that we can ask ourselves as we start to dive in and have a better understanding of our own bodies. What is working? What's working to support me? Where do I have restrictions? Where do I perhaps have a little bit more freedom? How does this feel in my low back? How are my feet connected to my low back? Good, so you can do this sort of self-exploration for as long as you like. Again, I feel like I get a little bit tired as I go back and forth here. Some suggestions for when you're ready to stop: relieving the pressure on both feet, allowing that sense of settling and softening in for several breaths. And then do something that's symmetrical. So that might look like drawing your knees up in towards your chest with a little side to side. It might look like doing some windshield wipers. side to side a couple times, just to kind of rinse out that motion. And then when you are ready to stand up, I suggest that you do it a little bit slowly, taking a few breaths through the transition. And then once you're up, walk around a little bit. See how it feels to have that same sense of connection through your feet, into your legs, into your pelvis and low back while walking. And notice if you can see how the hips are shifting as you're walking, and maybe having a little bit more awareness, a little bit more freedom of movement through this area.